Now we will start from this question. The most common organism causing shunt infection in a child with hydrocephalus. Okay. The options: Shigella, Staph epidermidis, Group A beta hemolytic Streptococcus, Parvovirus B19, Streptococcus viridans. How many of you agree with this Staphylococcus epidermidis? So the most common organism causing shunt infection in a child with hydrocephalus is Staph epidermidis. Reading from a source now. The most common organism infecting CSF shunts are Staphylococcus. In that, 40% of shunt infections are caused by Staphylococcus epidermidis infections and 20% by Staph aureus infections. So other species isolated from infected shunts include Streptococci, Enterococci, anaerobic gram-negative rods, and yeasts. So the correct answer is 40% is caused by Staph epidermidis and 20% is caused by Staphylococcus aureus. So the correct answer here is Staph epidermidis. This picture I will send in the group later. Treatment of migraine acute attack. Options they have given is the acute attack is sumatriptan. Whereas if they have asked prophylactic migraine, you will go with propranolol. Okay. Please note down this. If it is acute attack, you will choose sumatriptan. If it is prophylaxis, you will choose propranolol. So treatment of acute attack. One is let them in let avoid them in light, so let them in darkness in a quiet place, let them sleep, and you can offer NSAIDs and triptans. This is the treatment of acute attack of migraine. Let them be in darkness, quiet room, sleeping. You can supplement them with NSAIDs and triptans. Whereas what is the treatment for prophylaxis of migraine is beta blockers, propranolol. There are other options, methylxanthine, CCB, valproic acid, TCA, but you will choose beta blockers, that is propranolol. So let's go to the next question. So the next question, site of astrocytoma tumor. The most common site for astrocytoma tumor is the cerebellum. Okay. Next is case of status epilepticus. So status epilepticus can be they can present due to meningitis, due to intracranial bleeding, due to encephalitis, due to structural brain anomalies. But I don't think the breath holding attacks can cause status epilepticus. So the question here is causes of status epilepticus. You have to select, means one answer is wrong, means one is not the correct answer for this. That is the breath holding attacks. So the most common cause of status epilepticus is meningitis, intracranial bleeding, encephalitis, and structural brain anomalies. Next is EEG stimulation by all. So to take an EEG, we will sometimes we will take it is done under hypoventilation, sometimes hyperventilation, sometimes we use photoatic stimulation, but I don't think fasting is used for EEG stimulation. Okay. So EEG stimulation, the answer is fasting is the wrong answer. We can do sometimes hyperventilation, and photic stimulation. I think this is phototic stimulation. I will check for you. For the next question, assessment of neuronal migration. So you use MRI. For neuronal migration, you use MRI. Next, boy with head trauma and irregular breathing. What next? Short case, no more details. So now he has head trauma, I agree with you. But the problem is there is irregular breathing. So the first thing we will attend is the irregular breathing. So what you will do, what is the next step? First step is the intubation, stabilize the patient, and then you will go ahead with CT brain or MRI or whatever. So the first thing what you will do, boy with head trauma and irregular breathing, our first preference will be stabilization of the patient. So we will select the intubation. Next question, TB meningitis is a cytotoxic reaction. They would have given options, but you will choose cytotoxic reaction. Now we are done with neurology. So previous classes, including all, we have done with the neurology. But one thing what I have observed is this Barra, Prometric, and this Naja, they both are same. In Barra, the more options is given, and in Naja, directly they have given what is the correct answer. So now we finished with Barra, so we will do neuro with Naja, and then we will come back to this nephro. So child is unable to stand suddenly after upper respiratory tract infection. That means he has ataxia. So the common CT brain is normal. So the common cause for this is acute cerebellar ataxia. That is varicella influenza. The cause can be varicella influenza. Next is the myelination. Myelination will occur at the age of 0 to 6 months, but brain myelination is more in between 6 to 12 months. Next is how to recognize facial nerve during parotid operation. So you will recognize it by the as the facial nerve leaves the mastoid process as the nerve leaves through the stylomastoid foramen. I think this picture I have sent in the group. You can see mastoid, the facial nerve coming out of the stylomastoid foramen. Then modified Glasgow coma scale for infants used to grade coma in infant. Okay. Best description of rheumatic chorea. How do you describe rheumatic chorea? Rapid, jerky, non-rhythmic, involuntary movement. This is how you describe chorea. Rapid, jerky, non-rhythmic, involuntary movement. Chorea present with all of the following except akinesia. Akinesia means no movement. Definitely chorea will have movement. It will not present with akinesia. Next, 10-month-old boy, mother noticed he's 10-month-old. Mother noticed left eye deviated to one side 1 month ago. What to do? That means he has squint. 10 months old boy, mother noticed left eye deviated to one side 1 month ago. What to do? Refer to ophthalmologist. So this is squint, we will refer to ophthalmologist. It is normal till 3 months of age, we have to do reassurance. So next is best, what is the best investigation for neuronal migration? This is a repeated question again. It is MRI. Okay. Next question. Child, he has convulsion, tonic-clonic for 40 minutes, temperature 38. Temperature 38 and tonic-clonic convulsion for 40 minutes. It can be febrile convulsion, which is prolonged febrile convulsion. So it is symptomatic status epilepticus. Symptomatic status epilepticus. Next is the case scenario of seizures. That is history of URTI. Otitis media last 2 days. Best treatment. See, case of seizures. He has URTI and otitis media last 2 days. And plus fever means it is mostly febrile convulsion. But even if it is febrile convulsion, we will control it either with lorazepam, diazepam, or midazolam. So lorazepam will be your answer. Next, patient with status epilepticus. Which type is not common in pediatrics? Pediatrics, not common in pediatrics is cryptogenic. Cryptogenic. Febrile and idiopathic are the common types. Febrile convulsion and idiopathic are the common type of convulsions. Cryptogenic, which is 14%, it is not common in pediatric age group. Next is rare clinical presentation of Huntington's disease in children. Rare presentation is chorea. They are telling chorea, but I am not sure. I have to check this question. Rare clinical presentation of Huntington's disease in children. They are choosing the answer as chorea, but I don't know. What about, do they present with rigidity, dystonia, and bradykinesia? I don't know. Head circumference in first 3 months. The growth of head in first 3 months is 2 centimeters per month. We should know this. For revision, I will again tell you, for the first 3 months, the growth of head will be 2 centimeters per month. For the next 3 months, it will be 1 centimeter per month. For the next 6 months, it will be 0.5 centimeters. So if we take for the age of 1 year, first 3 months, it will go 6 centimeters. Next 3 months, it will become 9 centimeters increase. Then at the rate of 0.5 centimeters per month, for 6 months, it will be 3 centimeters. So totally here it is 3. So 6 plus 3 is 9, 9 plus 3 is 12. So in a 1 year, the growth of child of head circumference should be 12 centimeters in total. Okay. Next question. Head circumference, 4 months old, body weight 3.5 kg. Head circumference at birth is 35 centimeters. Now, head circumference at birth is 35 centimeters. Now, 47 centimeters. In 4, see, we read that it should be, the head circumference should grow by 12 centimeters in 1 year. But in 4 months, the child's head circumference has gone 12 centimeters here, from 35 to 47. And length is 50 centimeters. Now, in 4 months, he has grown 10 centimeters. No change in sucking since birth. So, the correct answer here is you will do brain MRI to check what's the problem with the child. Next is IV dexamethasone is used in meningitis due to H influenza type B. enlargement of head in a 2 years old child could be due to, we have to check for the causes of enlargement of child in 2 years old. Okay, it could be due one answer is wrong. I think congenital rubella syndrome will get microcephaly, not macrocephaly. So this is the wrong answer. The other causes of macrocephaly in these children is rickets can cause macrocephaly, chronic anemia can cause macrocephaly. So they will give you other causes and they will ask you to correct the wrong answer. So first line medications for status epilepticus include all, except, I don't think there's something called intravenous valproic acid is, I don't know. This one is there. No. So the wrong answer here will be intravenous valproic acid. So the first line medications will be diazepam or lorazepam or midazolam. This is one group. The second, after that, if still there is status epilepticus continuing, will go to phenobarbital or phenytoin, but still loading dose and maintenance dose. Then still if the status epilepticus continues, we will go for intubation. Rapid sequence intubation. This is the treatment of status epilepticus. But here he is still giving intravenous valproic acid, which will be a wrong answer. Next, 10-year-old boy sustained 30% BSA burns, body surface area burns, and has been requiring dressing changes for physical therapy. Which of the following regimens will provide best pain management? Oral morphine and oral lorazepam. I think morphine is pain control, lorazepam for the control of anxiety and other things. A burn wound characterized by absence of painful sensation. If there is no painful sensation, then it is painful sensation, bleeding or capillary refill, then it will be full thickness. Full thickness burn, that is grade 3 burn. 4 years child come with fever and rash all over body. Fever and rash all over body, and he is irritable, vomiting, and he looks ill. 4 years old child came with fever. A rash all over body, and he is irritable, vomiting, he looks ill. What investigation you will do? Either you will choose blood culture, and since he is irritable, you will also choose LP. But first you will send blood culture, then you will, if child is drowsy, irritable, you can go ahead with antibiotics, then you can consider LP. So it depends upon the status of the child. Features of acutely raised intracranial pressure. Features of acutely raised intracranial pressure. Here we have to remember the Cushing's reflex, where we will have bradycardia, hypertension, and irregular breathing. So, tachycardia is not a feature of acute raised intracranial tension. It causes bradycardia. Other features will be hypertension and irregular breathing. So, white reflex in pupil of left eye of a newborn is retinoblastoma. Wernicke-Hoffmann disease is all true. Wernicke-Hoffmann disease, all true, except Wernicke-Hoffmann disease, what is it? It is a spinomuscular atrophy. It's spinal muscular atrophy. It is autosomal recessive syndrome. Okay. The baby will be hypotonic and breathing difficulties. But he is telling is a mild form of poliomyelitis. This is wrong answer. So this is all true except means you will consider this. The most common complication in cerebral palsy is epilepsy. The most common complication of cerebral palsy is epilepsy. Mental retardation is association, not a complication. Mental retardation is an association, not a complication. So epilepsy is the most common complication of cerebral palsy.